Today, I'm presenting a quantitative microbial risk assessment that we performed for cryptosporidiosis among dairy farmers in New York and New Jersey. If you don't know what cryptosporidiosis is, it's a gastrointestinal illness caused by Cryptosporidium parvum. So for a healthy individual, typically this looks like 2, maybe up to 5 days of discomfort, staying home. But for the very young or the very old, cryptosporidiosis or the immunocompromised, this can result in hospitalization and even death. So we have a range of outcomes here, but the protozoa Cryptosporidium parvum, which is one of 2 species that causes cryptosporidiosis in humans, the other is hominis, is what we were looking at for this study. So protozoa are, they insist, so they are extremely persistent in the environment. They can live for a long time in soil and in water and in the digestive tracts of mammals. The reason we focused on Cryptosporidium parvum is because this lives in the digestive tract of cows. It can make cows sick, or cows can end up being carriers. So typically adult cows will end up being carriers of the protozoa, and calves might end up getting sick and have diarrheal type symptoms. So when we look at the risk of cryptosporidiosis in humans, we get it through contaminated drinking water, recreation in pools or surface waters. It is extremely resistant to chlorine, so the typical treatment in pools does not work for Cryptosporidium. And farmers. Cattle contribute to about 15% of the outbreaks in the US. And you'll notice here that the CDC's recommendation is to wash your hands after touching animals to prevent cryptosporidiosis. We did this study on farms in New Jersey and New York. So we were collecting fecal matter from individual cows, and we sampled at 7 different farms. They were all family-owned farms, and they ranged from 10 head of cattle to our largest was around 130 head of cattle. While farmers do wash their hands, there was less concern from what we could observe about disease to the farmer and more concern about washing their hands and sanitation around milking. So that big CDC recommendation, wash your hands after touching animals to prevent cryptosporidiosis, we really saw a range of that on the farm. Some farmers washed their hands more consistently, some farmers less, some facilities didn't have very evident hand washing stations at different points of contact where the farmers would be going inside or in the barn. When we went into this study, if from earlier, I mentioned that when we think about cryptosporidiosis, we're thinking about the young, the old, the immunocompromised. When we think about farmers, we're typically thinking about these healthy individuals. However, we're at these family-owned farms, and we realized that sometimes we had multi-generations farming and working closely with animals. So we did have the elderly that were still very hands-on with the animals, as well as kids active on the farm. So the populations we were concerned about farmers potentially getting sick and bringing this home and exposing their family.
So go to the elevators and take it down to 1, and I'll meet you in the elevator lobby. Okay.
Potentially exposing their families that way. Their families were actually primarily.
Alexis, you're muted. Still?
Sorry about that. We're using quantitative microbial risk assessment to assess the risk of cryptosporidiosis to farmers, and this is the framework that we're using. So we already did our hazard identification, our dose response. We used we used this exponential dose response model from Messner. And then for our exposure assessment, we were looking at the fecal excrement from the cows to the farmers' hands to their mouths. There's a lot of parameters that went into this method, but I want to point out we were taking our concentrations from the 70 individual cows we sampled amongst the 7 different farms for this exposure. And then for our reductions, we had a hand washing reduction, a mask reduction, and a glove reduction parameter. We also had a probability of illness given infection because our exposure, the endpoint there is infection. So what this gave us was an annual risk of about 12.7% of cryptosporidiosis to the farmers if they were not partaking in hand washing or any PPE. That risk lowered to about 11.6% when they engaged in hand washing, about 12% when they engaged in glove use only, and a very low decrease when engaging in only mask use. When they combined hand washing and gloves, it reduced to about 7.6%, and hand washing gloves and masks, it reduced to about 6.5%. The comparisons between the treatments were significant between nothing and hand washing only, and between hand washing and mask use only, but are very significant, are less than 0.001 P factors here were between no treatment and hand washing and gloves, and then every other treatment and hand washing and gloves. And that includes the hand washing gloves and mask. So we had a quite significant reduction there. So our takeaway here is that the PPE is significantly reducing cryptosporidiosis to farmers. And it's important to know that if we are going to ask them to do something uncomfortable. It's hot, they don't want to wear masks, they don't want to wear gloves, and from what we saw, they are currently not engaging in PPE use. So knowing that there's a significant reduction can help to promote that behavior. Thank you very much to ERC for this pilot project, and to my mentors on this project, Dr. Seals and Dr. Elliott.